All right, welcome to this segment of About Health. I'm your host, Dr. Mike Lenoir. Very seldom are you able to interview a legend in his own time. Dr. Talbert Small, as a physician, is in that category. For over 35 years, he has been practicing in the city of Oakland, but his journey to medicine is an example for all of us of how interesting a life can be. So, Dr. Small, welcome to our program.
Thank you.
Now, you grew up in Detroit. I mean, obviously, you probably knew a few Motown people, but tell us about your journey to medicine. What got you interested in it, and how'd you go about structuring a career?
Well, my roots go back to Mississippi. I was born in a shack in Coldwater, Mississippi. Because of racism, my mother had a ninth grade education. My father had a sixth grade education. He used to sample cotton in Mississippi. And he stopped at one little gas station, actually. It's the same, Hernando, Mississippi, where James Meredith was shot. And he forgot to say sir. And he got cussed out. So he said, I'm getting out of there. So he took the track north like a lot of people did. And I was a baby when my mother brought me up from Mississippi. And we lived in a section of Detroit, which was the worst part of Detroit. It was called Black Bottom. Joe Louis came from that area. Actually, I went to school with his nephews and nieces. And there was no real decent education for the kids in Black Bottom. My brother, who was a few years older than I, went to Duffield grade school, and he stole the pencil. And my mother took him back to the school, and the teacher told her, well, all these kids are going to prison. We're not trying to educate them. We just want to keep them disciplined. Ironically, one of my patients who has a PhD went to the same school 10 years ago, and the same teacher told his mother the same thing. And so my mother said, I got to find another place for my children. So she asked Mrs. Steele, who lived across the street, said, why don't you try St. Mary's? St. Mary's was this Catholic school in Greektown. So she shipped my brother off to St. Mary's, and then when I was 5 years old, she shipped me off to St. Mary's, which is how we got tracked dealing with the Notre Dame sisters who would teach us to read and write, and how I got tracked into the Catholic system, where I wound up going to Jesuit schools for 8 years. I went to Jesuit high school and Jesuit college. And that's my background. My family was trying to escape the Mississippi racism, and they went to Detroit, which wasn't a real promised land, but at least they were able to secure employment and educate their children.
When did you get interested in going to medicine, and how did that all work?
Well, you know, we were all involved in trying to make positive changes. I was working for the Student Nonviolent Coordinating Committee, and I thought,
this is before you...
This is when I was in college. And what I thought it would be useful to have a skill where you could bring it back to the community and do some good. And at that time, in the 50s and 60s, there were very few doors open for African Americans. In medicine, thanks to Howard and Meharry, medicine was one of the few doors that were open, because, you know, the northern medical schools traditionally had 0 to 1 African-American physician, and most of the African-American physicians went to Howard or Meharry, and African-American physicians had a tradition of taking care of the underclass. You know, the AMA, they fought Medicare, they fought Social Security. They wouldn't let African-Americans be in the AMA, which is why we have the NMA. So there's a long tradition going back to the 19th century of our people going into our community. In those days, we even lived in a community because we couldn't live anywhere else anyway. And we took care of our people, you know, regardless of their ability to pay.
Now, so you went to medical school in Detroit, is that correct?
That's correct.
And then you decided how'd you get to California? I mean, because you're mostly associated with California. How did you get here?
Well, I like to say my family escaped Mississippi, I escaped Detroit. Detroit was very difficult for African-American doctors in those days. Dr. Charles Wright, who founded the African-American Museum and wrote a book about the NMA, he talks about how he would call up Women's Hospital to admit his patients, and they would say they have no beds, and he would go walk through the hospital and there would be 50 empty beds. They had a quota on African American patients. He had an Indian resident who was doing his residency in OB, and he found out the white residents were being paid more than the Indian residents. My best friend in college became the first black neurosurgeon in the state of Michigan, Lucius Tripp. And he and I actually had worked with SNCC together in NAACP, various civil rights groups. He was a chief resident and graduated at the top of his class. When he applied for the staff of the hospitals in Detroit, they told him, leave Detroit, you'll have a great career. And they would not let him on any of the hot staffs. I think Harvey...
And that drove you to California?
Yes, it drove me to California. Harvey Glass told him that he could get on the staff of Mount Sinai, but he could only operate on Wednesday afternoons, and he had to assist Dr. Glass in his operations, but Dr. Glass would not have to sue him. So I thought my family tried to find less racism by moving to Detroit. I think I would try to find less racism by leaving Detroit and going to California. That's one of the reasons I came out here.
Now you came out here, you trained in internal medicine, but somewhere along the line you became associated with the Black Panther Party.
There were actually 14 free clinics among the 45 Black Panther Party chapters. And we set up actually the first national sickle cell anemia program. If you'll talk to Elliot Vashinsky, he said they were not able to get any money for sickle cell anemia until after the Panthers set up their program. We had Linus Pauling on our board of directors. We had Ossie Davis's brother on our board of directors. At that time, there was a Dr. Scott Roberts.
Roland Scott.
Yeah, who published, were you familiar with the article? He published the article where there was less than $100,000 being spent on sickle cell anemia, 1.6 million on cystic fibrosis, 7.9 million on multiple dystrophy. And sickle cell anemia had more morbidity and mortality than all those other two diseases put together.
All right, we'll be right back after this break.
Hi, I'm Ellen Bryan, a Miss America hopeful from Ohio. This is my sister Christina. 9 years ago, she was struck by lightning while working on a golf course. Her injuries were extensive and permanent. Christina and I are here today to tell you how to protect yourself. Lightning can strike up to 10 miles away in all directions from a thunderstorm. If you see lightning or even just hear thunder, go indoors and stay there until 30 minutes after the storm has passed. Just remember, when thunder roars, go indoors.
When I grow up, I want to be a psychologist or a therapist.
I want to be a pediatrician.
I was hoping to become a chef someday.
I want to study law. I don't want to become a lawyer. I want to become a CIA agent.
Young people, I think, do need a mentor because, we don't know everything. And, all the people, they've experienced stuff that we haven't.
I would like to be a baseball player.
As long as there's somebody behind you, pushing you and supporting you, then you feel that you always have the strength to keep going.
Each of our children has hopes and dreams for their future. Help them get there. Become a mentor.
What does hope look like? It's in the rising walls of a home rebuilt, raising the spirit of a community reborn. What does heart sound like? It's in the rhythm of nails pounded into wood, a beat driven by the conviction that inspiration can overcome desperation. What does home feel like? It's in the faces of Americans who built generations of memories in their home and then saw it slipping away, until friends they had never met turned out to lend a hand. For more than 30 years, Rebuilding Together has spread hope to homeowners in need, providing free home rehabilitation, making homes safer and more energy efficient. This is a place where you can turn dreams into reality. Go to rebuildingtogether.org and share the feeling of home.
It is so easy to give back.
I don't have a lot of money to help people, but I do have something. I have time.
Get up and do something.
Just imagine how strong a society we could be.
Every one of us has a role to play in making our communities and our country stronger. Discover yours. Help us continue to make a difference in the life of our nation. Go to serve.gov and find the opportunity that works for you. And this message is brought to you by the Corporation for National and Community Service.
I'm big. I'm big. I'm big. I've done big things. Some even say I'm bigger than life. But you know what? There's nothing bigger than life. Not when someone you love is fighting to live. You want to do something big? You want to do something big? Sign up to donate marrow and save a life. Take the first step at bethematch.org. See how big you can be. You could be the one to save a life.
Welcome back to About Health. Our conversation with Dr. Talbert Small continues. When we left, we talked about your experience with the Black Panther Party, and that connection led you to China and a relationship with acupuncture, which continues today. Tell us what you saw and what you did to bring it back to this country.
Well, China opened a door for myself to get involved with acupuncture. What was so amazing was it was so common. Like, they would have what we would call them kindergartens. They would call them children's palaces. They would be daycare for the kids. And you see 5- and 6-year-old kids doing simple acupuncture points on themselves, like Hoku, large intestine flow, Shushan Li, and they would be doing the points on themselves. And so what the Dr. Wu taught us was, one, that acupuncture was simple and it was not difficult to learn, and that we followed the Chinese tradition. What happened was, when I got back to the United States, I was working at the West Oakland Health Center, and David Bacon had actually translated the first book in a Western language from a Chinese textbook called Basic Acupuncture Techniques. He actually had me write the introduction to it. And so I used that book, and Alex Fang's a fairly prominent acupuncturist in Oakland. He and I would meet once a week, and we would do all the points on ourselves. And once I felt I could do the points on myself, I felt I could do them on any patients.
Now, let me ask you. Now, you were in West Oakland. We're very, because I remember when I first went into practice, I was hanging up a picture and I didn't have on my tie, and one of my patients said, "Well, we don't like our doctors without ties." So, I mean, to introduce acupuncture in the West Oakland, man, that must have been an interesting experience.
I actually did acupuncture at the West Oakland Health Center, and at that time I was doing a lot of house calls, and acupuncture was illegal in California. You had to be research. So I had these cards made saying I was a research acupuncture, and I would go around these houses and see people. I would do acupuncture on them, and I would also do the medical visit. I would take the Medi-Cal sticker, and I would bill for the medical visit. I couldn't bill for the acupuncture because it was illegal. But I did acupuncture during house calls all up and down West Oakland and North Oakland.
What were the people's response to acupuncture?
It worked. The pains went away.
Yeah.
I got rather dramatic results. 80% of the time you get relief of pain, and most of the time it's a significant relief of pain. And I was helping people, they were quite pleased with it.
Do you use it in your practice today?
Yes, we do use it in our practice. We're limited by the fact that Medicare does not pay for it. Medi-Cal does not pay for it. My managed care people will pay for it, but I have to get their permission to do it. I have to ask Hill physicians, will you allow me to do it? They'll say yes, but you can only do 6 treatments. And if the patient's a Medicare patient, they'll say you'll never be able to get any more treatments after the 6 treatments.
Are you surprised now at how easy it is to get acupuncture now, and all these acupuncturists all over the place?
Yeah, when I came back here in 1970, there weren't any acupuncturists. I was one of the first ones in this country. And now there are probably more acupuncturists in California than there are physicians. They're everywhere. I never thought that a method of treating people and poor people in China would now be a method in this country for treating the yuppies and the buppies and the upper middle class, because most of the acupuncturists, they accept cash, and so the people who can afford to pay them cash are not poor people.
Now, from your broad-based experience, I mean, you've seen probably some very great. What do you think about the healthcare system now? Where do you think we're going?
Well, we were talking about, I wish there was a vaccine for greed. I think if we could eliminate greed, our healthcare system would be serving the needs of the people.
What about the Affordable Care Act? Are you excited about it?
It's a step in the right direction. Unfortunately, I wish it had gone further. I wish we had a single payer system. I wish we had a Medicare option so that when the pharmaceutical industries decide to charge $1,000 for a pill, that maybe we would have some leverage over them. Of course, when Bush set up the Medicare Part D, he met with the farm car people, and they're not allowed to negotiate cheaper rates. If this happened in China, we'd call it corruption. And if this has occurred in the United States, we call it business as usual.
Right. You know, even though we've improved over the last 30 years of your practice, the health of African Americans still lags behind the health of the rest of America. I mean, it's unfair to ask, but why?
Well, you know the reasons. One is poverty. Two, no matter how many black presidents you have, there's still going to be racism in the United States. Why is it that only black kids are being shot on the streets? So I think one reason is poverty, and one is racism. And one of the things about poverty, it leads for a lack of education, a lack of health care.
Yeah. Well, in the 1 or 2 minutes that remains in our program, tell us a little bit about your poetry, your interest in it, how you got involved in what it does for you and what you think it does for other people.
Well, I've been writing poetry for over 40 years, and if you'll read my poetry, you saw it goes through various stages, and I feel it's a way, every person is an artist. Every person has his own creativity. My patients have their own form of creativity. Poetry is one of the ways I use to try to exercise my creativity.
Well, Dr. Small, I'm telling you, it's been quite a journey, and it's fact that the journey continues. What's in the future for you?
Well, we're like old mules. We'll keep plowing as long as we can plow. And I think that's what the future holds for both of us.
Right, all right. Well, I appreciate you saying that. I never looked at myself in that context, but hey, maybe I need to revisit it. But look, thank you very much for joining us.
Thank you so much. It's always a pleasure.
Thank you for all that you've done.
Thank you.
All right, we'll be right back after this break.
When I grow up, I want to be a psychologist or a therapist.
I want to be a pediatrician.
I was hoping to become a chef someday.
I want to study law. I don't want to become a lawyer. I want to become a CIA agent.
Young people, I think, do need a mentor because, we don't know everything. And, all the people, they've experienced stuff that we haven't.
I would like to be a baseball player.
As long as there's somebody behind you, pushing you and supporting you, then you feel that you always have the strength to keep going.
Each of our children has hopes and dreams for their future. Help them get there. Become a mentor.
What does hope look like? It's in the rising walls of a home rebuilt, raising the spirit of a community reborn. What does heart sound like? It's in the rhythm of nails pounded into wood, a beat driven by the conviction that inspiration can overcome desperation. What does home feel like? It's in the faces of Americans who built generations of memories in their home and then saw it slipping away, until friends they had never met turned out to lend a hand. For more than 30 years, Rebuilding Together has spread hope to homeowners in need, providing free home rehabilitation, making homes safer and more energy efficient. This is a place where you can turn dreams into reality. Go to rebuildingtogether.org and share the feeling of home.
It is so easy to give back.
I don't have a lot of money to help people, but I do have something. I have time.
Get up and do something.
Just imagine how strong a society we could be.
Every one of us has a role to play in making our communities and our country stronger. Discover yours. Help us continue to make a difference in the life of our nation. Go to serve.gov and find the opportunity that works for you. And this message is brought to you by the Corporation for National and Community Service.
I'm big. I'm big. I'm big. I've done big things. Some even say I'm bigger than life. But you know what? There's nothing bigger than life. Not when someone you love is fighting to live. You want to do something big? You want to do something big? Sign up to donate marrow and save a life. Take the first step at bethematch.org. See how big you can be. You could be the one to save a life.
Hi, I'm Ellen Bryan, a Miss America hopeful from Ohio. This is my sister Christina. 9 years ago, she was struck by lightning while working on a golf course. Her injuries were extensive and permanent. Christina and I are here today to tell you how to protect yourself. Lightning can strike up to 10 miles away in all directions from a thunderstorm. If you see lightning or even just hear thunder, go indoors and stay there until 30 minutes after the storm has passed. Just remember, when thunder roars, go indoors.
Welcome back to About Health. We're fortunate in this segment to have as our guest Mr. Duane Poe. He's the Executive Director of the Bay Area Black United Fund. And one of the focuses that they have as a core mission is on health. Thank you for joining us.
Thank you. Appreciate to be here.
Tell us a little bit about the Bay Area Black United Fund.
Well, the Bay Area Black United Fund has been around for about 40 years. In the last couple of years, we have rebranded and re-identified the organization to continue to expand our work around health and improving health disparities in the Black community throughout the Bay Area.
You know, when we talk about health and health disparities, many people come at it from a different angle or different angles. What is your take on it, and how are you approaching solving the very many problems that health disparities cause?
Well, we're approaching it from a couple of angles. The overarching angle is health is not just physical health and not just mental health or emotional health. Health is having a job. Health is being educated. Health is living in a violence-free community. And health is our Black males being thriving and successful individuals in our communities. And so we see the broader definition of health. Certainly the traditional definition is important, but we recognize in order to be healthy, you have to have the full breadth of opportunities in order to be successful in our society.
You know, that's a big challenge. Violence, the problems of Black males. How do you focus on one piece of it, or what are the action items that go with that very big agenda?
Well, we have a couple of programs called the Health Conductors, which many of your viewers are probably have gone through the program. There are about 1,000 health conductors throughout the Bay Area. We're currently designing a new program called Youth Conductors for a younger population. But our main goal is to, one, create narrative, what we call narrative change, changing the way that we see ourselves within our community, but also changing the way folks outside of our community see each other. And so we're doing a series of interviews, and we're going to be doing a billboard campaign, and we're going to be doing a marketing campaign online, as well as through events like this, in order to change the way that we see our health. We're also going to be an advocacy organization. And so we are working with partners, and hopefully partners like you, in order to advocate for change around the health in our community.
Okay, I'm probing specifically. That's a big challenge.
Mm-hmm, it is.
I mean, and are you looking at it from the perspective of youth, or behavior change, or community change, policy change? I mean, what are the elements that you specifically think the Black United Fund is uniquely designed to address?
I think, first of all, it is all of those, and it is a big lift. We are being clear that what we need in the Bay Area is an organization that first and foremost puts Black people first. And in putting Black folks first, we think the health of our Black community is the most preeminent vehicle for us to be successful in the Bay Area. And so we are seeking out new partners. We certainly have relationships with funders, both on the public and private side. We have relationships with community-based organizations. But we're also building relationships with new partners so that we see and understand what the needs are of our community from both a disparity perspective, but also from an asset perspective. We have a tendency to talk about what's not working. We're going to focus and talk about what is working.
And one of the things that seems to work is the Conductors Program. Tell us a little bit more about that program. And has it been as successful as you'd hoped?
The Health Conductors Program is essentially a behavioral health modification process that individuals like yourself or myself decide that you want to change some health outcome. And you agree to participate with another class of folks. I think we generally run classes with about 40 individuals. And it takes about 4 months, and you go through a curriculum, and you have partners, and you have a guide, and you choose some health change that you want to make. Traditionally, it's been things like obesity, high blood pressure, the kind of chronic disease kinds of conditions. The success of the program has been documented not only in research, but also through testimonials of individuals that said, this has changed my life. So the Health Conductor Program is probably the thing that we are most known for in the community. And we are expanding the program. We revised the curriculum this past year, and relaunched the program. It had not had classes for about 3 years, and so we started that back up this year. We encourage any of your viewers who are interested in participating in the next session to contact us on our website, which is www.baybuff.org, in order to enroll in the next class. And we need organizations like this Buff to ensure that the needs and the opportunity and the assets, as well as some of the deficits of our community, are continue to stay in the forefront of policy decisions, both in local government and state government, in community discussions where young people are looking for ways in which to find their way in life and be successful. We think that the Bay Area Black United Fund gets to be that voice for our community in the Bay Area.
Well, Mr. Duane Poe, Executive Director of the Bay Area Black United Fund, thanks for taking the time to join us.
Pleasure to be here. Thanks again.
Thank you for joining us on this edition of About Health. A lot of interesting topics. Hope you got some information that you can use. Remember that health is your biggest asset. I'm Dr. Mike Lenoir. We'll talk again.